I should also say thank you to everybody here present today. This session of ours will go around explaining a bit about the digital cyber health grant that is currently live, as well as what our sort of engagement was with the ECCC on this topic, and how we got interested into it, and why we're having this webinar today. So again, my name is George Buhai. I've been an active spearhead for the DNS for Gov initiative on behalf of Whalebone. And I've been engaging with the ECCC for about a year now on this topic of cyber health, because I looked at this array of grants coming from the ECCC, and especially those that were part of the digital program, all of them being live as of right now, and how they could potentially be used to start what we refer to as protective national DNS projects. So whenever we're talking about a specific sector type or industry within a country, whether we're talking about public administration, healthcare, critical infrastructure, and so on, obviously without starting somewhere, we cannot address the issue of all member states needing to have PDNS projects as soon as possible in response basically to what we refer to today as the European threat landscape. And I'm going to dive deeper now into the grant itself. I can then provide a bit of knowledge about how I engage with several EU countries so far. And to that extent, I should mention that I'm currently exchanging with every national computer emergency response team, so CERTs, all national CERTs in Europe, CCERTs, as well as national cybersecurity centers, in full cooperation, obviously, with the ECCC, with the likes of ENISA, EU CERT, and so on. So I will be talking about the grant. I'll be talking about our best practices and how we think for healthcare providers and hospitals specifically, what would be their best method of approach towards this program. Obviously, this is just a piece of advisory from our side. If you find value, if you find that this is useful for you, as soon as this webinar is over, please do get in touch with us. Ask for further presentations and deep dives into the subject. We're sure that we can help you prepare better for this. But obviously, what we want right now is to get as many eyes on this as possible, because we are approaching quite a quick deadline, unfortunately, and there needs to be a certain chain of actions that need to follow as soon as possible for these consumers, these hospitals and healthcare providers to take advantage of this opportunity. I will present the agenda in just 5 steps. So we're talking about the introductions to the grant itself, simplifying the procedure. Then we're going to go through the application walkthrough, and my colleague Vladimir will be talking about POCs and case studies. This grant itself is shaped to look like a POC, basically. So in order to prepare for it, the best way from our perspective was to make available our tool completely free of charge for the benefit of hospitals and healthcare providers to use it and to get a readout that will help them with their application. Basically, the result of a readout with DNS for Gov can easily cover about 70% of the application itself. But I will get into it in just a few seconds. So about the grant, again, it's basically a call for proposals under the EU's digital program to fund projects that will reinforce cybersecurity in hospitals and healthcare providers. Now, you will see that the definition is quite abstract. We don't necessarily understand the limit of what a healthcare provider is, but to the extent of hospitals, clinics, any type of emergency room units or providers of this type of services, this grant is fully open. The deadline is unfortunately the 7th of October, which means that we don't have a lot of time, and this is why we will be talking about this POC and how to accelerate the application procedure. Funding rate 50% flat. Call budget is set at 30 million euros as of right now, and everything relates to when we're referring to deadlines and everything like that, we're obviously referring to Brussels time. So on the 7th of October at 5 p.m. Brussels time, this call will be closed. A short description. The goal is to ensure that hospitals and healthcare providers can effectively detect, monitor, and respond to cyber threats. The objectives refer to this action supporting pilot projects to improve cybersecurity in hospitals and healthcare providers. Of course, the projects will also help healthcare institutions comply with NIS2 directives, which I know was something on everybody's mind over the past year and a half at least. And the expected results are, of course, the action will deliver a mapping of common cybersecurity needs and healthcare guidelines for self-assessment and technical plans. And moving forward, I want to talk about the grant in a very resumed fashion. The slide will come up probably in just a second. It has. Okay. So the minimum requirements for the consortium building. So in order to apply, you need to be part of a consortium. What does this consortium look like? So there needs to be at least 2 users, 2 hospitals or healthcare providers from 2 different states minimally, which both of them use services provided by cybersecurity authorities, either at a local, regional, or national level. So let's imagine that we have the Czech Republic and Slovakia as examples. We would have 2 hospitals from each country, each of them working together with their national cybersecurity center, for example, and together they create a common SOC at the National Cybersecurity Authority level that will provide services to the hospitals, and they will also provide any type of trainings necessary or workshops dedicated to the healthcare provider staff. We saw this working in a way that there needs to be some kind of intervention from that National Cybersecurity Authority, because if every hospital in the country came up with their own project and proposed that action plan to the National Center, the National Center would have not had the capacity to carry it forward. So in our eyes, we saw this working the best kind of way with the National Center creating some kind of minimal set package with DNS security or endpoint security, various trainings that all of the national coordination centers I know are actively pursuing in every member state, and they could provide that together to every hospital in the country that would want to take on that package. It would mean that everybody would be basically getting the same thing at scale, depending on their size. But it wouldn't be such a burden for that national authority to then act upon and provide support for. This is actually a drawing of what I've just mentioned. So we have the 2 NCSCs at the top with their team leaderships. And then we would have on the left side from country 1, we would have 2 hospitals and 1 clinic, for example. And on the right side from country number 2, we would have a healthcare alliance composed of multiple healthcare providers and a different hospital. Everybody would have support, technical support coming from the SOC itself, while it makes perfect sense for the national centers to provide their trainings in their language of choice. So if we have, for example, Spain and France participating, it makes no sense for the guys in France to provide all the trainings for the Spanish teams. That will be done by the Spanish side. This is just an example. Otherwise, It's completely up to the NCSCs to see exactly what type of services they can offer to each other and to their constituents. And this is what I was talking about with regards to that minimal package that is needed. We can talk about network and parameter security, DNS security, DNS filtering, discuss the importance of threat intel, and so on. Obviously, we at Whalebone, we are discussing DNS for Gov. We're expressing our intention to secure the DNS side of things together with threat intel, as our project is directly linked to onboarding national certs and their feeds onto our program. And we are proposing, obviously, a POC, again, a service that is provided free of charge for the hospitals. If any hospital wants to onboard right now, so they could have enough time to receive a readout that will help them understand exactly what their threat situation looks like today, and involve that as part of the application, they can do it. Get in touch with us and we will help you as soon as possible. The simulation itself, when the NCSCs basically shake hands and decide to collaborate, we are already in touch with several consortiums that are being formed. So if your specific national center does not want to participate, again, do get in touch. We will help you at least communicate with other consortia and try to be part of something else if you couldn't find your own type of group of institutions that you can collaborate with. We can help with that as well. Regardless if you're an NCSC, we can help out. If you're a hospital, we can definitely help out. And even if you're an NCC, a National Coordination Center, we can already get in touch with multiple other bodies and try to create this network so that people can collaborate better on the topic. Sketching the scope is an important part of the application. And as you can see here, we can basically help with steps 1, 2, and 3. Define the state of preparedness through the readout. Again, this comes after a minimum of 2 weeks of POC, basically. An overview of cybersecurity solutions. Obviously, we can define that set of information that is relevant for DNS for Gov. Developing a technical plan and demo. So basically, we are providing a POC, which is also what this entire grant is about, creating a national POC and then disseminating that to other EU member states. We can help with all the information that we currently have from previous cases, as well as from other cases that we know part of this grant. And then cybersecurity education and training will mostly be done by the national coordination centers. Best practices and EU-wide scope are something that the national centers usually take under their own wing. I'm looking at the time as well. I want to make sure I leave enough for my colleague, but I just wanted to show a breakdown of what the work packages could be. So we spoke about a minimal set of requirements. A work package itself, in the way that you need to answer the question, why are we creating this project? What do you want to get out of it, and what will you put into it? So basically, you can define it as a limitation of click-throughs through malicious campaigns. We know that everybody is affected by ransomware, phishing, any type of malicious activity could be limited by limiting the number of click-throughs when such a malicious campaign comes around. And another milestone to it would be that every institution that takes place would need to confirm that they can get 100% participation of their own staff to whatever sessions of training and education will be added to it. And of course, we're talking about the evaluation. We can definitely monitor the exposure to ransomware, for example, in 12 months. So we can have it as part of the project to limit ransomware effects by 50% in 12 months, for example. This can be part of your application, and we can help you define exactly what it is that you need, first of all, and then what it is that will make your application successful. Just a few words about the application topics. So there are two parts, A and B. Part A with general information, participants, budgets, and other questions. And Part B, which is the slightly more complicated one, relevance, implementation, impact, work plan, and others such as declarations and so on. And as I've said, basically the result of running a POC with DNS for Gov can help you write about 70% of that 70-page document that needs to be sent before October 7th. Evaluation criteria refers to relevance, implementation, and the consortium's ability to deliver, as well as the impact, all of which fall under making the project successful, which we can definitely replicate since we have ongoing initiatives exactly like this that are perfectly successful in other European countries. And what happens after submitting the proposal? Well, basically, you're going to wait for quite a bit to get an answer from Brussels. But what we can guarantee, and this is the point where I will get the point across to my colleague Vladimir, is the fact that, okay, you're running a POC with DNS for Gov. You had your readout, you had all the information that you needed to write your application. If you want to continue using DNS for Gov for as long as it takes before you get an actual answer from the European Commission, we will allow you to continue using actually the product completely free of charge. And this is our commitment to trying to engage with as many hospitals and healthcare providers and trying to help them access these funds. There is absolutely no commercial obligation related to this, and we only hope that enough people will see this as an opportunity to get better protection, both for them, their users, their guests, and everybody close to their institution. With that said, I hope I haven't overstep my welcome. Again, thank you very much for your time. Thank you for your attention. Thank you for being here. The floor is yours, Vladimir. Thank you very much.
Thank you, George. So let me share my part of the presentation. Maybe in the meantime, we have one question in the chat that is relevant more to your part. So we might answer it in the meantime, if you want.
I'm seeing the one from Norbert. I hope I'm pronouncing the name correctly. So the phones come with sharing one SOC with multiple hospitals, even in different countries. Could you give us a real example? It's not the users themselves who will be promoting the SOC. It will be the national centers, and national centers do have various tools that they can use to collaborate cross-border, as well as providing support for their own constituents if needed. But this is for them to decide how they want to actually collaborate. If they would have, for example, one of the national centers provide all the technical support, or if they just want to do it for their own hospitals, but share information at a high level, so that others can learn from them. This is something that is completely not defined, let's say, at least at this point, and is subject to how the NCSCs want to interpret it. But it's definitely at that level. It's not up to the hospitals to create that SOC, to run it, or to manage it in any way, shape, or form. I hope I answered the question.
Yeah, perfect. Okay, maybe one question from my side. Can you see my screen? Can you hear me? Someone's typing. Yes, perfect. Okay. Firstly, I don't want to overwhelm you by a lot of technical details, but I would like to quickly propose mainly our experience with hospitals and healthcare sector overall. And it might be also good to state or say why protective DNS provide Whalebone solution. is great for this use case. Yeah. As you probably know, hospitals are somehow distributed networks, but with a huge amount of bring your own devices. You have patients, you have doctors with or personnel with their own phones, and basically with a lot of devices that are not manageable, that you want to protect. It's a hard task with other security solutions. From what we experience or what we propose, it's really good that we can apply different policies or different security measures to different subnets. As I said, you have patients that they will have strict policy with some kind of content filtering, because I don't want them to, I don't know, download torrents from the hospitals or visit any adult pages, let's say. Then I have personnel and the doctors. I will apply strict policy without any content filtering, or just to block the OH, not to bypass the existing DNS infrastructure. And the last part, which is also hard to cover, are the devices. Usually, even when in manufacturing, for example, you have a lot of IoT devices that you can't install anything. And with this kind of group, you can deploy a zero trust, as we would say, group that would only allow domains that are specified in some kind of spec sheet or some technical documentation. Another good thing is that we provide the on-premise solution also with the cloud one, and we can deploy the solution in various ways to suit the needs of the situation. For example, from my experience, Czech hospitals or hospitals in Czech Republic, they usually require to have the solution being hosted inside their network, while other companies or other type of clients, they are okay to host to have resolution towards the cloud. Yeah, there are some downsides, maybe something that's easier depending on which type of deployment you use. But no matter which solution you choose, there is always the quick deployment, and I will talk about it later. And what we used to say, or what we really want to say out loud, is that users are not aware of the protection until something is actually blocked. Yeah, we call this zero disruption cybersecurity. And just in healthcare, we have real-time threat intelligence. So each resolver has in his database around 40 million of malicious domains. We protect against random generated domains, against DNS tunneling. We verify DNSSEC for each query. This is NIST requirement, so everyone that falls below to NIST will need to apply some kind of DNSSEC validation. Since it's network-based and not, let's say, device-based, you don't need to spend any time on maintenance of endpoints, since Whalebone can deploy multiple resolvers and specify multiple policies. It can be used to have the guest network protection, medical IoT coverage, and for roaming devices or devices traveling outside of the network, we can provide you also with the off-net protection. Again, fast deployment, zero disruption, continuous DNS traffic analysis, which is very beneficial even if you don't block any traffic. You can see interesting patterns in the DNS traffic itself. And with blocking or with the auditing of the malicious domains, Whalebone provides real-time threat detection, which is again in NIST2. What we need for a successful POC is active collaboration between Whalebone and the organizations. and the point of contact on a customer side should have the authority to carry out infrastructure changes. So, for example, to change where the DNS resolution is being forwarded or which resolver is used, and also the contact should have the authority to allocate appropriate resources for the proposed changes from our side. Now, quickly on the two deployment options, we have the local one that we deploy locally on prepared Linux machine, the resolver itself. Then on the DHCP level, the DNS server setting is assigned to all and the devices, and they are directly connecting or are resolving through the Whalebone resolver. That means that this will ensure high visibility. So in the portal, administrators can see whatever device exactly contacts the resolver or is infected. One thing that to mention, just need to forward internal domains to already existing infrastructure, and everything else go outside to the internet. Quickly to the minimal required hardware, it's a 2 CPU cores, 4 gigs of RAM, 40 gigs of space on a virtualized Linux machine. We usually say that at least 2 resolvers are recommended to ensure high availability, but also horizontal and vertical scaling is possible. But with this setup that has 2 resolvers with minimal requirements, the setup should handle around 2000 QPS, which is around 25,000 individual users. For the cloud infrastructure, just point from your existing resolver in the network all the resolution towards the Whalebone cloud. The POC timeline, how it looks like. Usually we have some kind of POC kickoff when we estimate the user base. So we establish the user base and load to propose how the infrastructure will look like, and we will discuss how the deployment will be handled. If we go with the cloud deployment, if we go with the on-premises, or any other kind of mixed or hybrid type of deployment. And then there is infrastructure preparation that's on the side of the customer. So customer will prepare usually 2 Linux machines according to the proposed sizing. They will ensure that they have static addressing, some network requirements, and that's not important, I think, right now. But then we meet again for around 1 hour, where the deployment is handled together with the customer. We install resolvers, configure the policies, forwarding, reporting. We will teach the customer how to use the portal. And after this deployment, there is a gradual rollout to the new resolvers. It will usually, depending on the size of the customers, it usually takes around 10 work days. After everything is forwarded or rolled out to resolvers, we usually have 30 days POC, which is then ended by the POC evaluation. The POC evaluation, it's some kind of audit for the customer. We usually take all the blocked or audited data. We prepare a detailed presentation with some explanations what each type of malware can do, and what is the amount, for example, of the blocked queries, and so on. Later in the presentation, I will quickly show you how the evaluation can look like. But this is how the POC timeline looks like. I would like to say that since the time is pretty limited, we will probably go with the cloud solution, if possible. And that makes things easier and faster. And if also some kind of compliance is ensured from the other side, things can happen pretty quickly. Yeah. And now let's show 3 real-life examples. Maybe what's typical for medical sector, or what we see in every evaluation is that we usually block more phishing than in other fields, because there's a lot of let's say not protected devices, and devices not exactly in the network itself. And what's even more common for these phishing domains is that they usually come from not legitimate streaming platforms, and it's some kind of part in redirection chains. Yeah. Also, we see a lot of gambling, some games and porn sites, and this is for both personnel, usually or typically during the night shifts, and patients because they are bored. What we also see are spikes from heavily infected devices, and we can even from the threats sometimes say how long the patient stayed in the network, because it's typical for command and control malware that it's periodically trying to connect to some kind of server. Yeah, so it's trying periodically to resolve the domain which is blocked. And we also see interesting browsing patterns, especially during Christmas nights and weekends. Also, since the flow of the people is pretty dynamic, we see changes of the blocked traffic. One example from evaluations, I did the evaluation last week on Friday with one hospital in Czech Republic, and we saw that they had a browser hijacker installed in 3 devices for the last 90 days, which was actually two days, the 7th of June and the 13th of June. It did around 84 queries which were blocked. The browser hijacker changes settings of browser. Usually infection comes from some kind of fake browser extensions or freeware, usually some converters or some programs that can edit PDFs. And the hijacker does redirections towards other malicious content. And usually what's typical that it starts usually with some kind of phishing or malspam campaigns, and after there's some kind of phase-in with this kind of malicious content, there's another distribution of malware to deploy here some kind of command and control malware, for example, to log the data from the computer and so on. Then another example from another hospital that's typical pop-ups, again from fake streaming platforms. They are trying to push the user towards allowing some kind of notifications. It either again downloads some kind of browser extension or turns on some JavaScript, and the serving of pop-ups starts, and again it's distribution of other malware. For last month, quickly, there was 27 queries in the hospital. And another example, this is less common, but we have some health insurance provider. I don't want to specify further to ensure some kind of anonymity, but during the evaluation, we found out that there was one device that was infected with the known Trojan, which is spyware that bypassed antivirus, and through some kind of distribution of malspam campaigns, it locks your keystrokes or sends some kind of information from the computer, from the infected computer. Yeah. So these were like 3, I would maybe say, typical examples. Yeah, a lot of phishing, again, a lot of unwanted programs, a lot of gambling sites and porn sites. And sometimes we see something more malicious, that is, for example, the command and control malware. And how does the evaluation look like from your side? We provide you with comprehensive audit of blocked or audited spreads with explanations. It's divided to several parts depending on the type of the malware, if it's command and control, if it's some kind of coin miner, or if it's phishing. We want to again go one step further. So we are trying to propose how to change the DNS setup of the infrastructure. Usually we see some kind of wrongly set up domain controllers. So even the resolvers have to translate unnecessary traffic, let's say. And we provide you with proposal of improvements on the product and infrastructure itself. This is all packed as a PDF presentation, which we send you after the evaluation. And that's all from my side. And hope you have interesting questions that we can answer.
All right, great. Thank you, Vladimir. Thank you, George, for your insightful talks. I just checked chat section, and there are no other questions that we should cover. So let's wait like few more seconds if something will be there or not. In the meantime, I would like to say that we will be sharing the slides and the recording of this webinar so that you can revisit the content at your convenience. I do hope that you found the session valuable, and we will be definitely looking forward to connecting with you in the future. I have also inserted contact or email address to George in case you would like to discuss your specific use case, or if there are any other topics that haven't been covered, then George will be definitely happy to discuss this with you, or Vladimir if the questions are tech related. Yeah, there's one question from Peter. So if we might go through it. What about National SOC? Is it going to have PDNS solution on its premises and then distributed to healthcare providers?
I think I can take that one. It's basically up to the consortium and how it's built. Basically, the National Cybersecurity Center can host the solution either on its own campus or using our cloud resolver. So we're completely open to both solutions. It's up to them to decide if they want the hospitals to have their own instance, or there will be a centralized instance and then everybody would just redirect their traffic to them. This is not something that we ever want to impose on the users. It's up to them to decide what's better for that specific use case. But we can definitely respond to both variants.
Okay, great. Hopefully, Peter, that answers your questions. And yeah,
I just had one more thing I wanted to say. If any of the participants are traveling next week to ENISA's eHealth conference in Bucharest, or at the Virus Bulletin in Berlin 2 weeks from now, I will be present at both. So feel free to get in touch. I'm more than happy to meet on site as well.
All right, great. So there are no other questions. So once again, thank you for joining us. We really appreciate you taking the time to be here. And I wish you a great day, and see you soon. Bye.
Thank you.
Thank you. Bye.